Thank you. Hi, my name is Christine Wilson, Chris Wilson. I work with NPAF as the Vice President for Advocacy Communications, and I have the privilege to lead this next panel, which I think is the ideal follow-up to Dr. Berwick's talk. He talked about how we are the 69th ranked healthcare system in the country, and of course, Mississippi, and this is quoting from the Mississippi Public Health Report, Mississippi remains one of the lowest ranking states in major chronic illnesses and important health indicators, and has the worst overall health outcomes of any state. So we want to talk today about not just Mississippi, but what Mississippi represents, and about some of the people who have brought their activism, their advocacy, their knowledge, and their incredible commitment to their communities to try to be the forces that change that. That make it truly a more patient-centered operation. And we're going to talk some about some of the financial motivations, but in many ways in Mississippi, it's the lack of money that is the problem, not the overabundance of it. So last year, we went to Mississippi, and we had the great pleasure, as we have had on several occasions, of working with Freddie White-Johnson, whom you will meet in a minute, who is an enormous force down there. And we went down to, she brought together a great group of people for us to talk to about shared decision making. How do patients make decisions with their doctors? How do they come to not just you taking penicillin because I told you so, but what's the right treatment at the right time that really fits what you need at that moment. But what we found, we had a lot of good discussion about shared decision making, but we also found that it's very hard to make shared decisions if you don't have access to care. And so what we want to talk about today really is what some of these challenges are. What are keeping citizens and community members in the Mississippi Delta from getting the care that they need, have a right to, deserve, and are struggling to get right now. So I'd like to start by having each of my panelists, introduce themselves, just who you are and your role in the community, and maybe just identify one challenge that you feel that you're confronting. And we'll start with Freddie, who, as many of you know, is the founder and president of the Fannie Lou Hamer Cancer Foundation. Freddie, tell us a little about yourself, what got you started, and why is it so important to have the Fannie Lou Hamer Cancer Foundation in Mississippi?
My name is Freddie White-Johnson. I'm the founder and the CEO for the Fannie Lou Hamer Cancer Foundation. And what really got me started with the Fannie Lou Hamer Cancer Foundation is because my father, who died from stage 4 lung cancer, and there was no resources that was available at the time. He died from lung cancer. And so by working with the University of Southern Mississippi, I saw a need to develop something that was owned and operated by the people in the Mississippi Delta. So from there, I created the Fannie Lou Hamer Cancer Foundation. The organization was named after Miss Hamer because she was a national and an international household name. So from there, we created the Fannie Lou Hamer Cancer Foundation, which is located in the heart of the Mississippi Delta to help those who are less fortunate.
Thank you. Yeah, Dr. Katherine Hughes, who is a nurse practitioner and a educator and healthcare provider. Can you introduce yourself, Dr. Hughes, and tell us a little bit about what's important to you?
Yes, I'm Katherine Hughes, and I currently work for Delta State University, where I teach the nurse practitioner as well as the undergraduate nursing program. Now, my passion goes way back. I've been in the nursing field for approximately like 38 years. But what recently I have decided to try to open my own clinic. So I am the founder and president and the CEO of On Track Medical Solutions. I'm in the startup process at this time. But the reason I wanted to do that is because of some of my family members that always have a hard time, whenever they're trying to access the healthcare facility. So that was the first off. And secondly, the reason I wanted to do that is because in the position I'm in, I would like for the nurse practitioner students to have somewhere that they can go and be precept to be able to further their education. So that's a little bit about me at this time. Thank you.
Thank you, Dr. Hughes. Mr. Sammy Foster, I know you've been a very active businessman, but you've also been involved with healthcare in the Delta. Can you tell us a little bit about yourself and what your passion is and what you think the one real challenge is for your area? You gotta take yourself off mute. Sammy, you're on mute. Okay. We got it. We got it. Mildred Wilson, while they're figuring that out, would you like to step in and tell us about yourself? You're an educator and you've also been very active in breast cancer health.
Yes, ma'am, sure. Good morning. My name is Mildred J. Wilson. I'm a community health advisor with the Fannie Lou Hamer Cancer Foundation. And it's our task to go out into the community and recruit female of any color between the ages of 44 and 64 with no insurance. We recruit them and give them a free mammogram and a PAPS.
Thank you. Mr. Foster, I see you have Mr. Starks with you too, so we'll get both of you in this. Hi, how are you? Mr. Foster, can you tell us a little bit about your involvement in the business community and the health community and what really makes you passionate about the challenges in Mississippi in terms of healthcare?
Okay, I'm Sammy Foster, president of the Floyd County Community Health Advisor, Men in Black and Blue Fighting Prostate Cancer. That organization was started from Ms. Freddie White-Johnson and the University of Southern Mississippi. A program that's been very effective. And my passion became years ago, even what I do, I'm in the financial service business. And coming in contact with people every day, you have to underwrite applications and looking at people's health. And I started in my early 20s and really didn't have any health problems myself, but I found out so many people had so many health problems. And it came along to me, so that made me being aware how very important it was to take care of yourself, go to the doctor, and have do annual exam once a year. And I always remember what my grandmother told me once when I was about 26 years old. She said, have you been to the doctor? And I said, well, for what? I'm not sick. She said, you don't wait to get sick before you go to the doctor. So it's kind of like a maintenance. You go in your car, you get your oil changed. So like I said, it's been a passion with me. And from what I've seen, things that's going on here in the Delta.
Thank you. And Mr. Starks, we're glad to see you there.
How you doing?
Good, we're good. Can you introduce yourself? I know you've worked with some different kinds of populations, and what do you see that's a real challenge?
Well, I mean, I've worked with the Mississippi State Department of Public Health for a number of years, for several years with Dr. Victor Sutton and present past Chief Officer Dr. Dobbs with his program with the Mississippi Delta Health Collaborative program here in Floyd County. And I was a project director with the State Department of Health in those counties that I served in North Mississippi. We focus on the health disparities in that particular areas, in those counties. We help create those health policies, and that was essential for the outcomes to be positive as relates to the heart disease, stroke preventions, and we try to educate those residents about the opportunities and the knowledge that it was lacking during that time about focus on their chronic illnesses. So we made a focus on that, and we implemented those policies and made vast changes in those communities. So the outcome was good in those areas in the Delta, particularly in the Delta.
Thank you, and we're going to talk about all that. I want to start with what I think is, what they say called the 800-pound gorilla. Mississippi is one of 10 states that has so far failed to expand Medicaid and make it available to the people in the state and in the community. Dr. Hughes, can you just open it and tell us a little bit about the impact of not having that aid available and how that hurts people in your state and in your community?
Yes, ma'am. It truly affects us all. because I've worked for numerous of federally funded clinics, and we see patients that are underinsured, no insurance, as well as self-pay. And then that do have Medicaid, is very helpful in at least trying to get them in somewhat to get the testing and stuff that they need. But sometimes even just having the Medicaid, if they don't allow them to have certain items on the Medicaid, it still prevent them from having the testing that they need. So it truly, truly, truly needs to be expanded to be able to provide quality of care. And a lot of time, like in the federal funded clinics, we still have to look outside for sources that will help us to be able to get certain tests. And we don't often find that as well. So if you have a nurse practitioner in a clinic that don't have that knowledge that it is other places that you can look for, resources to help the patient, then you're just kind of defeating the purpose. Like such as if we have like sample meds that come into the clinic. Well, if we give those patients the sample meds, once they're done with that, if they don't have money to renew a prescription or whatever, so you're still defeating the purpose because they're not going to purchase the medicine because they don't have the money or they don't have the insurance that may be, paying for a certain medication. So you can give them samples, but if they can't continue on the medication after that sample runs out, you just still defeating the purpose. And another thing that I find very difficult, like if you have a patient that comes in, we may charge them $25 or whatever to be seen. But then you get in there and when you're speaking with them and all, you find multiple other issues that are going on. So it's really, really difficult to address all of those issues in one setting. So, and then you have to determine whether or not what is the top 3 priority that we need to deal with today. So it's just multiple issues, the reason we really, really need Medicaid expanded.
Thank you.
yeah.
Freddie, or anybody else want to chime in on that? Contribute to that?
Yeah, I would like to say something related to that. Medicaid expansion, this is something going on since the Obama administration, and Mississippi have failed this state. And just recently here, it failed in the Senate and the House. And this continue on when you have a hospital here right here in Greenwood, that Medicaid expansion would help because you have so many people that are working poor, that works in these little small jobs, there's no insurance. And the hospital would be compensated a certain amount for them going there. And as the nurse practitioner was just stated a few minutes ago, a lot of them go to the ER. That's where they go to the doctor. They go to the ER, okay? You go to the ER and you get treated, and then you have no primary care doctor, internal medicine doctor to return to. So where you at? You're right back in the ER again. So that runs the cost up of the hospital. So it's a serious problem because, and you're looking at the Mississippi Delta, which we already the poorest state, and the Delta is continually drying up because you have the industry back, and you go back in the 90s and the 80s, the industry was striving a little here, but now everything is going northeast of Mississippi, and it's just drying up. So we have problems here in the Delta, and a lot of people are suffering because of that. We even looking at 2 institutions here that are in trouble. This one just the other day was in the paper. They about to close. I mean, it's just a financial crisis here in the Mississippi Delta. And I just don't know why our legislators won't go ahead on and try to do what the right thing to do, to go ahead on and pass that. Because all the other states have done, except I believe by 10.
And yeah. Freddie, do you, as you try to encourage people to seek cancer care or to seek cancer prevention care, do you find?
Yes, I do. I mean, I definitely agree with both Dr. Hughes and Mr. Foster and what they just said. But of course, we do need Medicaid expansion, but it's going to take everybody fighting for Medicaid expansion, just not one group of people. So I think that if the doctors themselves would perhaps go to Jackson, Mississippi, to the state capitol to a meeting during section and said, look, we want Medicaid expansion. And then I think it would have a greater value. It would have a greater impact. But when you only have a few people there who are trying to push for Medicaid expansion, And it looks like, to me, in my opinion, it's just a few Democrats Democrats there who are pushing for it. And then you got some Republicans saying we don't want it. And then, of course, our governor has not decided that Medicaid expansion is what's best for the Mississippi. But it's going to just take everybody to push it. And I think also that we need some national attention, media attention on why Mississippi has not gotten Medicaid expansion. With this being the poorest state in the United States, why do Mississippi not have Medicaid expansion? So it's going to just take everybody. And we need the help from national organizations like Patient Advocacy Foundation to help us to perhaps work with the state of Mississippi at a higher level to try to push for Medicaid expansion.
Thank you. Either Mr. Starks or Ms. Wilson, do you want to chime in on this? Or?
Well, I would say and stuff, just recently, a couple of days ago, the House and the Senate, they have reconvened, and I think they tabled discussion on the Medicaid expansion for this year. And hopefully going into 2025, it'll be successful and we'll have the expansion of Medicaid. The problem that was going on in the state of Mississippi, like Mr. Foster and Freddie alluded to, is like 138% of the poor or the poverty guidelines that affects the poor are affected by not having Medicaid. Like the case in point, what Mr. Foster said about the visit to the ER. I mean, most of the people that are working under that 138% threshold under the poverty guideline, they make a minimum income of $20,000, $20,000 to $25,000. So they don't meet the criteria as it relates to Medicaid. And now that's why it's so important, like Fred and Sam talked about and mentioned, it's important to expand it. I think it's unfortunate that we have politicians that are focused on themselves rather than the working class. And that's not only here in the state of Mississippi, it's nationwide. I think many people feel, especially the poor, feel like they unforgotten. They are the unforgotten population of America, and they feel like no one cares about them. And I think we need to put more pressure on our politicians to make change. We as people and citizens, especially of the state of Mississippi, need to have our politicians and hold them accountable for their actions. Like I said, I research Medicaid expansion. I think it's a great idea for the state of Mississippi. People need to understand with that expansion, the feds would pay, the federal government would pay most of the money to fund those programs and those incentives for those working class to honor the poverty guideline 138%. So it's imperative that we do focus on that going into next.
Mr. Starks? Thank you. All right.
I think that's probably why in this area, a lot of the minority are more reactive as opposed to being proactive. Instead of going to get your health care provisions each year, your annual checkups and things of that nature, we just go to the doctor when we have to go because of lack of income. So we just go when we have to go. And usually that's when you're almost at the last stage and there's nothing really can be done.
So that actually brings me to Dr. Hughes. You are a nurse practitioner. Can you talk a little bit about the availability of primary care in the Delta and the role that nurse practitioners and nurses? You said you're opening your own clinic. Why is it so important to have those primary care people, the doctors, so people can choose the doctors they want to go to and build the relationships that really make a difference in healthcare outcomes? Okay.
Rephrase that a little bit, please, so I can make sure.
No, I guess what I'm asking you is, why is it important to have primary healthcare people available so that people have choices about doctors And how does your role as a nurse practitioner fit into that, having that primary care available?
Okay, it's very important that we have primary care available, because a lot of time when I last checked, I think it was about 500 medical doctors in the state of Mississippi when it was numerous of nurse practitioners. And a lot of times some of the physicians don't want to see like the underinsured and the no insurance. So it's very important that nurse practitioners be able to have their own clinics where they can get these people in and get them seen. And a lot of times, if they can't get in to see a primary doctor, we can fill in the gap. It's very, very important that we have Medicaid in the state of Mississippi. Because take for instance, I teach the nurse practitioner. And now, from my understanding, they're trying to make a rule where even like just a preceptor nurse practitioner or to be a collaborative physician for us, they charge us tremendously. So it's just so many barriers when it comes to health, especially in Mississippi. Outcome, we have a lot of social determinants of health in our state. We have a lot of patients that don't have high school education, or even those who do have high school education and try to go on and go to college. Some of those still are from low income family and they still need that Medicaid. And a lot of times they cut them off at age 19. So then there they are. They may be college students trying to get a higher education so they can learn the importance of health. But however, they may not even have access care after age 19. So I probably went all over the place. I might didn't quite answer exactly what you were saying, but it is very important that we do have people come in. Like we have a lot of chronic illnesses like hypertension, diabetes, and hyperlipidemia. So if these patients are not being seen at least every 3 to 6 months, then they're going to fall through the gap. We need to make sure we're able to manage their health, look at their numbers when it's time for them to look, be documented, and wherever they may need some changes in their medication. So if we don't have primary health care to do that, we'll have patients that are in our community with alarming rates of their numbers being very elevated and not know. And then when they walk into these ERs, and then that's when they may get the help they need and they may not get the help that they need. A lot of times they won't even keep these patients if they don't have any insurance. So they go right back home and the next thing you hear about them in the news that they have deceased because they didn't get the proper care that they needed. So it's very important that primary care try to combat some of those causes and prevent them from having to go into the emergency room.
Mr. Foster, you're involved with the Black and Blue Men and trying to get people to get prostate screening and health care. Can you talk a little bit about how the scarcity of primary care physicians has an impact on that effort?
Yes, primary care is very important. Your internal medicine doctor, because that, as she stated, that's one of your areas of maintenance. When the patient goes to maybe the ER and the prescription is written in, she does not have a doctor, then it's right back. So, but if they have a primary care doctor there, they can go and then maintain the medication, then set up for another visit coming back. But if you don't have that, and see, that's the problem here in the Mississippi Delta, even over the state, we don't have nearly enough primary care doctors just right here in Greenwood. It's only a few, and then you get sick. It could be a person who have money, and you get sick and you don't have a primary care doctor, you got a problem. Because then if you go to the ones that's there, if you hadn't been already a patient there, you're not going to get in. It's sad, but that's the system. And they're overbooked, a lot of time. So primary care is very important because a lot of time that physician, and a lot of them have nurse practitioners there to manage that patient. And you can determine if they have high blood pressure, diabetes, or then doing the screening for cancer and all that. And the same thing, like when we do the health fairs, I tell you, every time we do one, we do the PSA, somebody in that group comes out with prostate cancer. It's just a numbers game. It happens that way. So it's very important. And then if you had a primary care doctor, after they've done it, they have somebody to refer to. But if you don't have that, that person is really just lost.
Ms. Wilson, I see you shaking your head. Do you work with people on breast cancer education? Do you have the same issues with women who need breast cancer mammograms or breast cancer checks and are not getting them because they don't have access to care?
We have the same problems with the females. You know, they don't have insurance. It's lack of insurance. And some of the ones who do have insurance have to pay that co-payment, and they can't afford it. It makes a big difference. And like Mr. Foster just said, if you don't have a primary caregiver, it's kind of hard to see anybody because, you know, you just can't get in. You just can't walk in unless you go to the emergency room. But we have a program here with the Fannie Lou Hamer Cancer Foundation that we work with the females through and males through the health department. So it makes a difference in getting them in to get the mammogram and the PAPs. It makes a big difference.
Right, let's see. Cue to you to talk about what you're doing in your foundation to help address these issues.
I'd just like to say, you know, it's what we got. The problem is just so huge here in the Mississippi Delta. When you talk about trying to get people in, you talk about fear. There's a trust. There's a medical trust here in the Mississippi Delta. Right now, if you go to I tried to get an appointment yesterday for EKG to be done, and they told me my appointment was going to be in September. That's a long time. And then your specialists, they're not here in Greenwood, Mississippi. They're like 2-hour drive, like in Oxford and Memphis or Tennessee. And then you see a lot of people who do have insurance, like myself. You have to pay a co-payment. Now the doctors, the physician, or the office are asking for that co-payment up front because they're having a hard time getting the money paid on time. They send you a bill in the mail. You may go 2, 3, 4 months without paying that bill, which put a financial burden on that physicians, and we do understand that. But we are faced with so many challenges here in the Delta. We are losing our hospital here in the rural Mississippi Delta because, you know, for whatever reason, we are losing the hospital. There's numerous reasons I think we are losing the hospital, but we are in desperate need for not just this conversation today, but it needs to be an ongoing conversation. We see so many national organizations come into the Delta. They get this kind of information. They put us on programs, and they're gone, and we still face with the problem of people dying prematurely. You should not be seeing so many young people dying. Last week, a young man got shot, and instead of them flying him to Jackson, Mississippi, they were trying to take him in an ambulance, and he died. You know, within 20 minutes of being in the back of an ambulance. So why not fly that young man? Because he didn't have insurance. And when you don't have insurance, you're treated different. And even when you do have insurance, you're still treated different. And people realize that. So it's just not just one thing that's going on here. Reason people are not going in to be treated for whatever's going on with them. But it's just a combination of things. And the problem is just getting bigger and bigger and bigger. We see more people dying prematurely here in the Mississippi Delta than any area in the country, and nothing has been done about it. I was driving from Greenville yesterday, Pine Bluff, Arkansas, and as I was driving down the highway, one of those crop duster airplane came down real close to my car, and they sprayed their gas and stuff on my car. And I was on the phone with Mr. Foster. I said, it ought to be against the law. Who do you report this to? Do we call EPA and make a report? They're spraying this stuff all day, every day. In your backyard, they're spraying it, you know, down the highway. Then they see the cars and they're still flying so low to the stuff, to the point you inhaling all this stuff coming from the air.
And I just wanted to piggyback on what Ms. Johnson said really, really quickly. As she stated, you can even have insurance. And when you go into these emergency department or these doctor's office, it's just the sense of urgency is different. It's totally different. I mean, I sat in an emergency room with my loved one for 6 hours, and I am the one saw the problem, knowing that I was getting that person there at the right frame where that person could have had some further treatment. And that person was covered by 2 different insurance, and then you want to try to remain professional, being, a part of the community. You don't want to act out or whatever. But now that if I replay that in my mind, I wish I had just berserk, because it was no reason why that person should not have been flown out. As I stated, was covered all the way around, 2 different insurance, and had to sit there for 6 whole hours and was fixing to be discharged until I finally was like, put my foot down. And it was like, no, you need to get on the phone and get me some help now, and I finally had to act out. So like I said, it's not just uninsurance, no insurance. It's something going on here, and it needs to be brought to someone's attention.
It's called bias in the medical treatment.
Exactly, the title that we are.
What they do is when they do see us or people of color, they write us a prescription and send us home. And I met one of my old professors the other day. He was sitting in the doctor's office. He had about 25 bottles because the doctor told him to bring all his medicine with him. He had about 25 bottles of medication, and all of them was different. And I'm just wondering, if you're taking all that kind of medication, something is conflicting with something's just not working. So now, how is this possible?
And then when they're not putting you on lots of medication, when you're dealing with diabetes here in the Mississippi Delta, if you come here, for every 20 people, African American that you see, you at least see 4 or 5 people with their leg amputated or their foot amputated. You see, it's always amputation when it comes to us. And it needs to be stopped. It does need to be addressed. But if you say anything, the first thing they want to say, here you go with this race thing. Well, you wouldn't have to talk about race if it doesn't exist. It is what it is, and sometimes people want to just sweep it under the rug like it doesn't exist. They don't see it. But it's going to take everybody talking about what they see going on in the Mississippi Delta, and more so, it's going to take Caucasians standing up and saying, "This is not right. I see what's going on, and this is not right." African American, for myself, I'm always crossing over trying to do what's right. But whenever do you see a Caucasian there who cross over trying to do what's right, I speak against what is wrong. And when I do it, you are ostracized by your own people. And then what do?
And Ms. Wilson, to piggyback on, I'm going to be quiet for a minute. When you ask me.
I like that you're talking to each other. That's great.
Yes, when you ask me why did I want to open up a clinic, because most times when I've worked for others, they put a time restraint on how long we can be in there with the patient, 15 minutes. And oftentimes when I've gone on an interview, I will tell them right up front, if you're expecting me to see a patient in 15 minutes, then I'm not the person that you want. Because it takes more than 10 and 15 minutes sometimes to get to the root of the problems with our patients. We need someone to be able to sit in the room and really hear them, because as healthcare provider, we know that we can only treat the patient according to the symptoms that they give us. So if you never hear those symptoms, you're not going to diagnose that person with the right diagnosis. It has been time almost on the brink of just talking with them at length, and last minute, they may tell me something that helps me to be able to pinpoint exactly what's wrong with them. So had I rushed them out of there before they even had a time to complete their conversation, then I would never been able to diagnose them. So that is why I would like to have my own. And I think I plan to tell my staff, if you put more than 15 patients here a day, then you might not be in the right business, because it's going to take me a while to be able to see each one of them and to see them adequately.
So let me just ask a little bit about access to specialized care. In our next panel, we're going to hear about multiple myeloma, which is a kind of cancer for which there's just been remarkable progress, but a lot of people don't have access to that progress. But so you mentioned that the poor guy who was shot and had to be driven or flown out of the area to get care. And I remember, I think it was you, Ms. Wilson, who told me somebody who had a heart attack who had to be flown to Mississippi to Memphis to get care, or people who have cancer who have to leave the area. If you don't have access to primary care, what does that mean in terms of get access to the specialized care when you're really sick and you really need some help? When you have cancer or you have a serious heart disease. Does anybody want to?
But
I would say what does
Everybody wants to. Donald? Mr. Donald?
Well, I mean, a primary care and specialized care, I know it's totally different. With that being said, we do have specialists here in LaFleur County on board that works with indirectly and directly with those patients. But the thing that I want to piggyback on is Medicaid expansion. With the work requirements as relates to Medicaid expansion, they are looking into using that as a means to expand Medicaid if you work and if you are 138% under the poverty guideline, you will be accepted and you will have access to Medicaid. That's in the future. But what you talked about specialized as relates to specialists, that is a problem here in both primary and specialists in LaFleur County because we don't have the resources. I mean, if I need to go to a heart specialist, I had to go like 2-hour drive, like to Oxford, and if I need to go to the foot doctor, even though I can go to Greenwood to a foot doctor, but he might be booked up for about 6 or 7 months. So it's a chance that I'm a diabetic or I suffer with diabetes, it's a good chance if I don't have the proper medicine or insulin, I could lose my leg. So, I mean, the wait time is a problem. The primary care is a problem. So we have 3 major problems here in LaFleur County as relates to this disparity. And I think it's at a crisis mode with that. And we should hold and I piggyback on our politicians. We need to hold them accountable. We need to hold the nurse practitioners accountable, the doctors, whoever that waits on our patients or our citizens. And like what Dr. Hughes said about the wait time, okay, 15 minutes is not enough time to diagnose a patient. And I have been in ER and the wait time is like 6 hours. Someone can die, and some people have died due to that fact. So we got to better educate ourselves. We're going to have to be more forceful and forceful about what we want for our people. Not only our Black people, but our white people too. All of us are important in this present day and time. So we got to educate ourselves. It's a win-win if all of us win, not one particular group. And I always emphasize that when I work with the State Department of Health. I mean, we talked about the health disparities. We have forums on the health disparities that plague the Mississippi Delta. We've created policies when I was working with the Mississippi State Department of Public Health on those changes. And we can do things and stuff to bring awareness and change some of the things that we do, our eating habits, exercise, things like that. You can bring down a lot of the decrease in those health disparities as relates to heart disease if we do little simple things. So like I said, primary care and specialized care is a problem. It's a big problem here in the Delta. And we're going to have to be more forceful and more proactive, not reactive to the problem. I think that's the problem what faces us as relates to the people in LaFleur County and the Mississippi Delta. We've been more reactive than proactive. We're going to have to be and hold these people accountable for change.
Thank you, Mr. Stark. That's a good.
We talk about eating healthy, but it's easier said than done. I don't know if you've been to the grocery store lately, but it's hard to eat healthy if you already don't have much of an income coming in. And then we're talking about going to the emergency is offered here. The emergency room care is offered here in LaFleur County. But then transportation is a major problem. If our patients if they having problem getting to a doctor here in LaFleur County, can you imagine the kind of problem they're gonna have trying to get to another county, another area? If they don't have transportation to move around the LaFleur County, they can't make it to another healthcare facility in another county or another area. So we have a lot of difficulties in this area that nobody is really paying attention to.
And that can even go all the way back to how you triage your patient as well in the emergency room. It's very important that you educate your nurses and all according to the type patient you may even get it presented to the ER. You know, you may have a patient that maybe have a little sore or something on their foot, or well, if they're not diabetic, but you don't call them back before you have someone coming in with chest pain. You know, so you got to know how to even triage just to be able to move the patient through the system the way they need to be able to even transport them on to another further department. So triaging the patient is very important. Since we are utilizing the ER so much, you need to even know how to do that as well so that you can get the patient back. Someone coming in with short of breath, you know that's urgent. You need to get that patient back. So I just wanted to put that in there too before you can even move them to a specialist.
Freddie, you can.
One thing I want.
I don't want to get Freddie here for a moment. But
I was going to just mention, just add a little bit to what's going on too, is health literacy. A lot of times the patient don't even understand what is being said to him or her. There was a situation where this young lady had STD, she had gonorrhea, and the physician gave her some cream to take home and use it. And he said, here, take this in 3 or 4 days, well, in 4 days or 7 days, when you come back, you should be clear. So he told her to come back in 7 days. And when she came back in 7 days, the STD was still there. And he looked at her and he said, it's still there. He said he gave her another set of cream, gave her some more cream, told her to take it, go home, use it, go home, take it, and come back. Came back, it was still there. The STD was still there. And then finally he said, what are you not doing? He said, I give you this cream twice to take home, and you still got an STD. She said, every time I take it, it is so nasty. She was taking it by mouth.
Oh, Lord.
Because he didn't explain it to her. He didn't say use it vacuum. So she was using by mouth. So communication is very, very important. Health literacy. And one of the things that we try to do with our program with the Fannie Lou Hamer Cancer Foundation, we try to bridge a gap between the community and the medical providers. So we have host sessions, training sessions, and health fairs, and we ask physicians who are willing and want to come to the community. So now it's bridging a gap between the community and the medical provider. So when I get sick, I know I'm going to Dr. Wilson because she came to my community. She spoke to us about diabetes. She spoke to us about high cholesterol and about cancer. So once you can build that trust between the community and the physician, it will also help eliminate some of the problems that we see that's going on here in the Delta. But overall, we fighting poverty. We fighting education, transportation, communication, and people just getting along as a whole and seeing people as human beings.
Thank you. Well, we're just about out of time. We could go on for the rest of the afternoon, but we do want to stick to our schedule today. I just want to say that, I mean, what you're talking about, the 5 of you, and I've seen your broader community. I mean, you have such an enormous commitment to your community and to making change. And it really starts with recognizing that healthcare is a basic right that we all have. We shouldn't be in, nobody should be in these positions. That you don't have a primary health care doctor, or you have to wait 6 hours to see somebody, or you can't see anybody at all because you don't have insurance. I mean, the situation in the Delta is very much illustrates what's wrong with the system. But what you're doing as individuals illustrates how powerful individual action and commitment can be. So I want to, really acknowledge that. And I'd love to continue this discussion, but we do have to stay on schedule. So I want to thank Dr. Hughes and Ms. White-Johnson and Mr. Starks, Ms. Foster and Ms. Wilson, the other Ms. Wilson, for your contributions. And we really look forward to seeing you again. We're coming back, as you know, quite soon. So, we don't want to be one of those organizations that comes in and just kind of takes something and leaves. We want to listen to you, we want to learn from you, and we want to help you advance your cause and hold people accountable and really make some changes. So thank you so much. I really appreciate it. We all appreciate it. And we will keep the conversation going.
Thank you.
Thank you.
All right, thank you.
Thank you. So as Gwen mentioned in her introduction, we do always like to have a data presentation, some real numbers. And we very much like to connect to some of the organizations that we're working with. Through our research group and through our Patient Insight Institute. And so today we have Shalini Reicher, who is a senior, let's see if I can get this right. Sorry, I have to. Senior Health Policy Analysis with IHEP. Is that right? And she really works at the intersection of health insurance, health equity, and social determinants of health. All the issues that we've just been talking about in such real and personal and systemic terms. So she's going to present us some of the data that she's found about the patient preferences when it comes to provider and environmental factors that matter most. Shalini, thank you. You're on.